CBCT technology should be the standard of care. And the reason that I say this is because a lot of silent or hidden infections can only be seen through 3D x-rays. And for example, this patient right here, he actually came in because one of his veneers fell off, but he said, hey, I have a slight discomfort on my upper right. And I took a 2D x-ray, didn't find anything. And I said, hey, let's take a 3D to see if we can find more information. And he actually had a big abscess on one of his premolars. As you can see here, this halo around this tooth actually means that there's an infection there. But not only did we find one infection, we also found the same infection on the other premolar, which wasn't bothering him. He didn't want for me to check it, but because we took a 3D x-ray, and that's an x-ray of the whole mouth, we found that he also had another big infection on the other side on his other premolar. And at this point, patients have three options. You do nothing, which I don't recommend. You get a root canal, which I also usually don't recommend. Or third, you get the tooth extracted, make sure that it's the PDL, the infection is thoroughly cleaned, and then later on you can get an implant there, you can get a denture there, or you can even get a bridge. So those are the patient's three options. He actually took a while before deciding on that option, and he ended up in the hospital because even though he was taking antibiotics, he actually ended up in the hospital because the infection got worse, and worse. So point is, if you have a dental infection, you have to do something about it. You can't just like let it slide and then wait because it's not hurting, because this is contributing to systemic health, so other systemic issues in the body. So highly recommend, if you have any dental infection, you get to the root cause of it and you make a decision on what you want to do with it.